As she shared, our topic today is strengthening relationship for value-creating healthcare system and that transition toward value-based care and how we design and deliver the healthcare that can support integrated, equitable, and whole person care have been one of the hot topics in healthcare. And importantly, one of the ways that value-based care models can create even greater value is by addressing the social determinants of health and unmet social needs. So today, we're welcoming experts in this area of work to open our conversation, Jen Perov, John Chapman, and Palmira Santos from the Institute for Healthcare System, IHS, at Brandeis University. So let me quickly start off with a brief introduction of our wonderful presenters. So first, Jen, here you go. Hi, Jen. So Jen is a senior scientist and director of the IHS, and she's a health service researcher with expertise in claim data analysis. And Jen's work includes the evaluation of care redesign activities within ACOs, value-based payment model design, and the cost and quality of nurse practitioner-led primary care. Jen will bring us a deep understanding of CMS value-based initiative to today's discussion, and she's eager to learn how everyone else and others promote value in their own work. And John here, John is a senior scientist at IHS, and John came to IHS after 30 years of work in government and industry, focusing on healthcare finance, and particularly provider payment. John's work includes design and development of the EPSO grouper system and part of the infrastructure for alternative payment models and analytic support for development of the merit-based incentive payment system. So today he comes to a discussion of value in healthcare, seeking more meaningful use of this degraded by important word. And Palmira, hi, Palmira. She has 40 years of experience as a research evaluation scientist and practitioner. She's dedicated to investigating inequities and structural barriers, the root cause of social and economic determinants of health, researching health, economic, and social factors on the national, regional, state, and community level to identify their impact on health and well-being. Building on these analysis, she has completed evaluation and research on the full health and human service continuum using community participatory methods. Her lived and clinical experience has deepened her ability to reach and connect with disadvantaged groups, those trapped by structural barriers. In addition, she evaluated providers, delivery system, and catchment area, examining the evidence from many sources with a focus on patient perspective to drive improvement. So she also created analytics to support provider-level research, targeting improvement for individuals facing structural barriers and inequity. So all of them are so wonderful. And now I'd like to invite John and Palmira to share their perspective on value in health.
Thank you, Leslie. First slide, please. So as any one of you who have been anywhere near the field of healthcare in the US anyway, over the last couple of decades are aware, value has been a popular buzzword for many years. Over that time, it's taken on some of the worst attributes of buzzwords. Signals virtue, but often without concrete and useful meaning. Sometimes even worse, it can be misleading. But it's had staying power because everyone understands that our system needs to get more value in return for the vast resources that we're devoting to improving health. My purpose in these few minutes is to offer some thoughts about how the concept of value can be better understood, thought about more carefully and systematically, and through that, used more effectively to improve health and healthcare. So next slide, please. I'm going to start with the dictionary definition, or a dictionary definition of value. The regard that something is held to deserve, the importance, the worth, or the usefulness of that thing. And we'll start by observing that this is I call it a gross value. It is the worth that we attach to whatever the thing is that we're valuing without regard to cost. In healthcare, the thing of value is health, or in the particular instance of health care, where you're seeking to get some change in health status, it is the increment in health. And specifically, it's the result of some activity. So the value of the activity is what we're speaking of, I would think, when we're talking about value in healthcare. For health more broadly, meaning health which has many determinants, the thing of value is still the increment of health, but regardless of what's driving it. The economists have disturbed things by introducing the element of cost, i.e. value in this perspective is the ratio, conceptually, of outcome over cost. It's the net value, the taking into account of what is given up in exchange for an increment of health. Next slide, please. The distinction between gross value and net value is one important distinction required for clear thinking about health and healthcare, but there are several others. One important set of distinctions are what Michael Porter called the tiers of outcomes. There's the immediate health status, either achieved or retained in the case of prevention. It can be mere survival, you're alive or you're not. It can be degree of health or recovery from one bad health state to a better health state. The outcome also has elements that have separate value to the patient and to those around the patient from the process of recovery. How long does it take? What's the pain involved? What are the side effects involved? The treatment-related discomfort, et cetera. And then there's how long it lasts, sustainability. A cure that only lasts for a week is not of much value compared to a cure that lasts for a lifetime. Next slide, please. There are also a number of other dimensions to value. There's the patient and the patient-specific conditions. Patients may perceive increments of health status with one condition differently than they do other conditions. Different patients may value different things. The judge of value is a dimension. The patient's clearly the central judger of value, but caregivers are directly affected themselves and may have some different perceptions that need to be taken into account. Society, especially where society is almost always involved in some fashion in providing the resources that either affect health status in the first place or the care in the case of disease and injury. So the society view with respect to that net value, taking cost and opportunity cost into account is important, and these are all different.
Thank you, John. We have been at Heller meeting for several months, lots of different folks thinking about value. And what was clear, and I think this is why John and I are here, is that there are many different perspectives. And as John says, I represent the dark side. So I'm going to talk about the evil through understanding structural barriers and that the influence of that and how that's key to value. We spend a lot of time, or we have, focusing on social and economic determinants of health versus the cause of that. So the cause of that, of course, is inequity. And what solidifies and makes it impossible to address inequity? Well, is indeed the structural barriers like racism, discrimination, classism, leading to poverty, lack of food insecurity and housing insecurity, the inability to earn a living wage, having to work 2 jobs, and take care of a family and share a small apartment with 10 other people. This is part of structural barriers that we have not been able to penetrate.
I'm going to say a few things to try to wrap up this whole conversation. I've been listening and furiously typing as everyone's been talking. And, I come to the discussion thinking about value as, outcomes divided by cost. How do we produce the best outcomes for the lowest cost? I, come from payment model design and economics. But I stepped back from this conversation with kind of 3 key messages I heard today. So number one, a critical first step in this value discussion is helping people define what they mean by value, their own values. What are the outcomes that they're trying to achieve? And there was a wonderful example in our group of a pack of value cards that a social worker uses in their own therapeutic work. But I think a lot of the conversation has cut across this definition of what it is that people value and what do we value as a system and as a society. I think another really critical theme has been broadening the aperture. So we were just talking about health, not healthcare. And as we think about the production of health, we need to move beyond an individual patient in a clinician's office, but think about going into homes, into communities, continuing to broaden that aperture of what we mean by health, what it means to be living an optimal life, and thinking about those different continuous relationships, also acknowledging that not everyone can fix everything. I think the third thing I'm going to mention is that as we work towards value, there are trade-offs that we are going to have to make. Resources are finite. And as we set up those conversations to decide whose values dictate the use of resources, who's at the table during those conversations, relational process is really critical through every one of those steps. Who comes to the table, whose voice is heard at the table, the process of determining those trade-offs. And so I think implied across what a lot of people I heard say was that there are potentially important relational tools that we can be using to kind of hatch these conversations at different levels of the system. So those would be sort of 3 big themes that I heard. But, I'm so excited for all of the energy in this conversation. And I really hope, in addition to the document that Masame mentioned, that we can continue these discussions as these work, because it's something we're highly committed to at the Institute for Healthcare Systems. So thank you, Jody, Masame, and everyone for this opportunity.
Thank you so much, Jen. And thank you everyone for joining today's RC Cafe. So the recording of this cafe will be shared with everyone. So please be on the lookout and have a great rest of your day or rest of your evening.